I'm Dr. Eppley, plastic surgeon of Indianapolis, and I wanted to discuss with you a permanent option to the use of injectable fillers for the lips and nasolabial folds. I have found that most patients are not aware that there are permanent implants that can be used in the lips and the nasolabial fold area for those patients who either do not want or are tired of having injectable treatments. These implants, otherwise known as Advanta facial implants, have been around for quite some time, although they're simply not well known by most. They are manufactured by a company that makes polytetrafluoroethylene vascular implants and have made a facial line for some time. These facial implants are used for the nasolabial folds areas, although they can be used for a variety of other facial areas for lines and wrinkles. Basically, they come as round or oval tubes made of a polytetrafluoroethylene material, otherwise known as a Gore-Tex-like material. Most of them come today on what is known as a trocar. The makeup of these implants are rather interesting in that it is a dual porosity type implant, with the internal aspect being much stiffer and the outer aspect being of a medium porosity, which is very smooth and quite soft. This results in a feel after their implantation not abnormally hard. What I really like about them is that if you distort these tubes or implants, they do not stay permanently deformed, rather they spring back to their original configuration. For those interested in a more histologic approach, if you look at them after a significant time implanted in animals, you will find that there is a fair amount of fibrovascular tissue ingrowth into the material, which is always a favorable sign for long-term implant success. At the time of surgical placement, I always soak them in an antibiotic solution, which I feel is important. I have really demonstrated that over the years by doing testing of the importance of that, and here we see an example in a petri dish of an Advanta implant which has been soaked just for a minute in antibiotics, and we can see the tremendous resistance to surrounding Staphylococcus bacteria. The key to its placement is that of the trocar, or long needle. This makes it easier to pass through the lips or the nasal areas. For the lip area, for example, a simple incision is made in the corner and the trocar is passed. The implant is then spread out and the ends are simply trimmed and closed. The same technique is done for the nasolabial folds with a small incision at the base or the side of the nose and then down at the bottom, deepest part of the crease. Often when I use it in the lips, because it is one solid piece across, I may make a small incision in the middle at the time of the placement and do a partial split of the material so that there is no chance that it will ever be banded or too stiff. And when done in combination with lips and nasolabial folds together, you can get an overall nice result that is otherwise permanent. I believe that these implants are a good option in the properly selected patient. This is not something that I would do for someone who is just coming in for their nasolabial fold or lip injections, because I think injectable fillers produce a good trial option. The patient then can ultimately decide down the road if they want to continue with injections or whether they would like to go on to a more permanent solution. My experience with these implants in the properly selected patient has been associated with a very low rate of complications. Most of the complications really refer to one being able to feel it or perhaps not having the optimal amount of augmentation. Again, these implants are FDA approved and are manufactured by the Atrium Medical Company out of Nashua, New Hampshire, and are known as the Advanta facial implants.